Assalamu alaikum. So according to the schedule, the session ends now, so يعطيكم العافية. But I was told that we have an extension. So I'm going to try and be short. So we're going to shift to less on the micro mechanisms of neuroscience into the bigger picture of public health and mental health. And I'm going to talk about some of the experiences we have in terms of dealing with mental health. So I lead the Global Mental Health Initiative, which is based at the University of California, San Diego. Some quick background. Mental health is not just the absence of disease. It is defined as a state of complete mental well-being, including social, spiritual, and cognitive. Mental illness, on the other hand, is a disorder, so it's different terms. It's a disorder that involves problems of cognition, perceptions, like we heard. Global health is another term that is the population of health across countries and across borders. So these terms, just some background. Now, in terms of the mental health spectrum, we have diseases of mental health in the population. We have them detected at primary health care, and we have in the psychiatric care. So these are where people with mental illness exist. I draw a line here, which is the line where myself and people in epidemiology like me and public health are more interested in mental health here in the population and primary care. Because here, when they need psychiatric care, that's really advanced stages. And they're already exhibiting symptoms that are antisocial, and they need really severe aggressive treatment. So here, the problems is these mental illnesses are not detected. So that's our job, is to try and detect them and deal with them in the population. Now, among the population, we have focused more on refugees because they are the most vulnerable. And among them, the children, who are the most vulnerable of the most vulnerable in the population in terms of mental illness, because they're neglected, because they can't speak, they can't express, and there's no expertise to deal with mental illness in children in most of the less developed countries. So why is it important? Public mental health is a problem because we have millions of people around the world, 300 million with mental disorders or more. Depression being the number one, schizophrenia, and all these other conditions. In terms of years living with disability, number one is mental illness. Here, it's not very clear maybe, but you can see that 22%, and then comes the musculoskeletal second. So mental and behavioral disorders are the number one cause of years lived with disability. And among those, these are the most common that we deal with: depression, anxiety, psychotic disorders, PTSD, and psychosis. Schizophrenia, mania, bipolar, all these diseases are more considered severe and dealt with by psychiatrists. And this is a continuum of where typically should be treated. The mental illnesses should be treated, dealing with basic service, community, focused, non-specialized, and then specialized, with the pyramid being that the small people need specialized, and most people are dealt with here. So this is the model from the WHO. See, it's self-care, informal community care, mental health and primary health care community, and then long-term. So this is how it's supposed to be. But in reality, this is how it is. Very few people seek self-care, and most of the people are here, they go into tertiary care with psychiatrists. Now, here's the problem. There aren't a lot of funding or psychiatrists in the less developed countries. So globally, spending on mental health is about less than $2 per person per year. And in low-income countries, it's 25 cents. This is the funding that is available to support mental health. Almost half of the world have one psychiatrist or less serving 200,000 people. So it's impossible to deal with this. And the funding is almost only like 36% of people live in low-income countries, and they have covered by mental health compared to high-income countries. And outpatient mental health facilities are 58 times more prevalent in high-income countries. So just as an example, in Jordan, there is 1.08 psychiatrists per 100,000 Compared to in the US, for example, there are about eight psychiatrists per 100,000. There is about 0.03 non-psychiatrist medical doctor in mental health per 100,000. There are about 93, only 280 person treated in mental health outpatient compared to 931 in the US, and facilities and so on. So this is all showing there's a major deficiency. Here, Jordan this is among the number of nurses per 100,000 population. This is mental health nurses. You can see Jordan is among the lowest. And the economic burden, we don't have data on less developed countries, but here from the US, you can see it's about 190 billion per year is spent on mental care. So it's a huge economical incentive to try and prevent it, because if we prevent it, there is a 1 to 30 cost benefit ratio and up to 350 long-term better life quality. If we treat them early, they're going to have better quality, better employment, better social life, less divorce, and so on. Now, Jordan has a major problem in terms of it's been a hub for refugees for over the decades, from the Palestinians, there are millions of them, Iraqi refugees who came previously, and now Syrian refugees. So there are a lot of people who need help in mental illness. In terms of the refugees' trauma, they are higher rates of psychological disturbances. Refugees experience a lot of diverse stressors. There's post-migration stress. And so the refugee experiences are characterized by multiple events occurring in multiple events, and they persist over time. So the suffering is not going to go away. This is an example of a survey of Syrian refugees in Turkey. 35% of children score above the cutoff of post-traumatic. 49% are in elevated range of children depression, and 36% are highly elevated. So a lot of them, a majority, have mental problems. This is an experience from a colleague of ours who is working with the refugees in Greece, and this is what she told me. She told me a 9-year-old refugee asked if I could adopt her. When I asked why, she mentioned that her father had passed away during the war and life has no meaning now, and that her family doesn't mean much. This is a 9-year-old Syrian in Greece. So this is severe trauma and mental illness that is going unattended, and they will live with this kind of trauma all their life. So this is the problem. What are the solutions? The global mental health movement is a relatively new movement, and it is basically addressing this from a health system-based strategy, shifting from the hospital to the community care, and it is a population-based strategy. So no longer it's going to the psychiatrist and waiting for that. It is shifting it away from the hospital. That's where we formed our global mental health initiative. So we're 4 universities led by us. So I'm an epidemiologist. This is a child psychiatrist. These are 2 psychologists, family therapists. These are 2 psychiatrists and a child psychiatrist from Harvard. So we are addressing this. We held the first conference in Jordan by bringing stakeholders together. People don't talk to each other. So here we managed to bring the UNRWA, deals with Palestinian refugees, the Ministry of Health representative of mental health, the WHO representative in Jordan, and the International Medical Corps organization that deals with UNHCR with the refugees here in Jordan. We brought them together and said, tell us what are the things that are needed. And here's where we came with not here. So we came with a second conference where we are to train and address all healthcare providers with mental health training. This is primary care, and this was in Jordan University. So we graduated just this year the first batch of primary care providers to deal with mental illness in their clinics. Those are family medicine doctors in the Ministry of Health, and they are going to be the people who are going to deal with mental illness in a primary care setting. The other aspect, and I'm going very fast over this, but because of running out of time, but UNRWA introduced a intervention where they put the mental health care in a clinic. So we came and studied the impact of putting that clinic in one primary care provider compared to another. And we found that people who are going to this clinic where there is mental health services were having less stigma. So they were accepting mental illness much better. So that's overcoming the stigma as one way to deal with this. So I'm not going to go over the results in the interest of time. And then we need to continue evidence gathering through research, because through research we can get good evidence, better healthcare, and decrease the prevalence. And this is a study that's ongoing. We are now looking at the positive aspects. How can we learn how people cope? We're studying children, Syrian children, who are able to overcome the trauma and be resistant to mental illness. Why? And we found that the social support was one of the major aspects helping them. Okay, so I will end here, and maybe we can move on to the panel discussion to answer questions. Thank you.